Today's webinar, Serious Injury and Fatality Prevention, Perspectives and Practices. During today's presentation, attendees will be in listen-only mode. To ensure that you can see all of the content for the event, please maximize your event window. To also maximize your slide view, click on the scale button located in the upper right area of the window above the slides so that it shows as 100%. If during the program you would like to submit a question, please use the chat pod located in the lower left-hand corner of your screen. Type your question in the box at the bottom and click Send. If you have technical difficulties, you may contact the help desk at 877-297-2901. And now I'll turn it over to Joy Inoue.
Thank you very much. And good morning or good afternoon. Welcome everyone to today's webinar. My name is Joy Inoue and I am the Research Associate for the Campbell Institute at the National Safety Council. And today I'm going to be taking you through one of the recent white papers we just released back in October. And this is on the first round of research that we were doing on serious injury and fatality prevention. So today in the webinar I'm going to be laying out some background information on SIF, as we say, and also some of the ways in which our Campbell Institute members and partners are implementing practices to eliminate serious injuries and fatalities within their organizations. So that is today's agenda. And I'll take you through a little bit first of an introduction into the National Safety Council and a little bit about the Campbell Institute as well, so you know who we are and what we do here. So the Campbell Institute is part of the National Safety Council, and this, what you see on the slide here, is the newest mission that our President and CEO put forth a couple years ago actually. And our mission for NSC right now is to eliminate preventable deaths within our lifetime. And Debbie Hersman, when she put forth this mission, she realized it was a very lofty goal. However, she thinks it is possible for us to achieve if we focus on those areas in which the most preventable deaths occur. And looking at those places in those areas, we zone in on the three major areas in which the National Safety Council does most of its work. Now, when NSC first began as a nonprofit organization over 100 years ago, we started with the premise of workplace safety, and that is where the Campbell Institute does most of its work. So when I present and give information and research on improving safety, it is in the workplace arena. So that is primarily where a lot of our work takes place, is in the workplace. However, we also know that preventable deaths occur in other areas as well. So we are also focused on home and communities. If you were attending our latest Congress and Expo in Houston back in October, you would have seen some the opioid memorial display that we had. And so that is one of the areas in which we're trying to focus or bring awareness to an issue that hits in the homes and communities, opioid addiction and the deaths that occur from there. We also know that a lot of preventable deaths occur on our roadways, and so that is the third priority area in which NSC does a lot of work. And so we've done a lot when it comes to technology in vehicles, self-driving cars, also bringing awareness to and minimizing distracted driving. These are the areas in which NSC does the most work. And a little bit about the Campbell Institute. So the Campbell Institute is basically a business unit of the National Safety Council. and we are considered the EHS, or the Environmental Health and Safety Center of Excellence at the National Safety Council. Much like NSC is a membership organization, so is the Campbell Institute. At this point, we are numbering at around, I think, like 37 or 38 organizational members of the Institute. Membership is vetted. We select those who have excellent records when it comes to EHS. Our vision for the Institute is to be that trusted source for protecting people and preserving the planet. Our mission is to help organizations, not just those who make up the Institute, but all organizations, to achieve and sustain that EHS excellence. And the reason we do this is because we believe that protecting people and preserving the planet are not divorced from business excellence, but are actually those integral pieces to business excellence. And to give you an idea of who makes up the Campbell Institute, this is our most recent honeycomb of members and partners that you see here. The partners are in the darker colored honeycombs on the right-hand side. So you can see this is our current Campbell Institute family, as we say. And you'll be hearing some examples as we go through this presentation from a few of these members and partners who have contributed to the research on SIF prevention. So if you're interested in more of the Campbell Institute and what we offer, I'll be giving some more information at the end of the presentation. If you would like some more info on how to connect with us and also how to join the Campbell Institute. All right. All right, so let's get into today's presentation. Like I promised, some background information on serious injuries and fatalities, and why the Institute and other organizations are focusing efforts to eliminating SIF. So you can see from this chart, this is kind of the current state of injuries and fatalities in the U.S. So in the past 20 or so years, the U.S. has seen really enormous gains when it comes to workplace safety, particularly as regards recordable incident rate. So you can see from this, from this chart that total recordable rate has dropped from about 8.5 incidents per 200,000 working hours to something like 3 incidents per 200,000 working hours, and that's in 2016. However, this reduction in workplace injuries, it shouldn't be overshadowed by what we see as a more disturbing trend in workplace safety. Let me get my pointer here. So you can see in this chart here, this is regarding deaths and death rate, and you see this reduction in the death rate over time since 1992. However, these numbers have been on a much slower decline as regards incident rate, and actually you can see it's actually tipped up in the past 3 years. So while incident rate is going down, we still have a death and death rate that has actually been rising recently. So this overall reduction in workplace injuries, it presents an interesting problem for safety professionals seeking to eliminate those serious injuries in our organizations. So unfortunately, for the purpose of data collection and tracking, this reduction in injuries actually means that organizations have less information and less data to mine and to analyze. Almost ironically, it's become more difficult for organizations to predict when that next serious event will occur because they've become so adept at preventing those injuries. So that's why we're asking, how can we derive more from less? How can we start to predict where the next serious incident is going to occur if we have fewer of those non-fatal injuries and fewer near misses to go from? And like we're saying here, there are fewer there are fewer non-fatal injuries, which is good. But what are we doing to prevent those life-altering events? We're doing a great job at preventing the bee stings, but what about those life-altering events and those serious injuries? So to understand how to prevent serious injuries and fatalities, we turn to this classic concept in workplace health and safety, and this is Henryk's safety triangle. And in this original conception, Henryk theorized that for every major injury or fatality, what you see at the top of the triangle, there were 29 minor injuries and 300 non-injury incidents. And while this triangle was accepted as the gold standard for many years, safety professionals today realize that there's kind of a flaw in this theory, namely that not all non-injury incidents are equal in terms of their potential for resulting in serious injuries and fatalities. Only some near misses have the precursors that could lead to recordable injuries, lost time injuries, and even fatalities. So in order to prevent SIF from occurring, many organizations have realized that they can't look at this entire triangle, at least not in the way that Henryk originally conceived of it. Instead, we turn to what you see on the right-hand side here, a new prevention model for serious injuries and fatalities. Instead, we have to focus in and isolate this part of the triangle. You can see this slice that we have here. This slice that has that potential for SIF and to prevent these incidents from occurring. Okay, let's go to the next slide. So as Tom Krauss of Krauss Bell Group explains, this subset of incidents with SIF potential are different from those without SIF potential. Those incidents with the potential for serious injuries and fatalities, they have different root causes. They also have different contextual factors that lead up to them. And because of these differences, organizations really require a different strategy altogether in order to prevent them. And treating all minor incidents and near misses as if they have the potential to result in SIF can actually divert attention away from those incidents that contain the most potential to result in something serious. So that is why we feel the need to isolate the part of the triangle with those with the potential for SIF. All right, we have some more things here to provide some background on SIF. Todd Conklin, I'm sure many of you are aware, has done extensive work to increase workplace safety by understanding human behavior and performance, and also our interaction with work processes and the environment. And he comes to this conclusion that you see here, that humans are error prone. We are just human. However, we can't make the workplace safer and we can't get to zero incidents by simply fixing the worker. We have to look at a broader picture, like the design of work, for instance. Ask ourselves, can the work process be designed in such a way as to eliminate human error? Corrective actions should be developed according to a hierarchy of controls to have safety depend less on employee behavior and depend more on a safety management system. We also have some research here from Rob Fisher. And he agrees with Todd Conklin that we can't eliminate the potential for injury or fatality by just focusing on the worker himself or herself. Fisher says that we also have to address some organizational, systemic, or procedural gaps. And he has some examples here. He says we have to look at error traps or those kinds of unfavorable conditions that can increase the probability for error. Also error-likely situations, or situations in which there's a greater opportunity for error because of performing a specific action, or a task, and there are error precursors present. He says we also have to look at organizational weaknesses, or kind of gaps in processes or values of an organization that can allow for the existence of these error traps or error likely situations. So once again, he is not recommending to fix the worker, but to look at the system and the organization as a whole. So kind of taking those, that thinking into account, we have a new way of thinking about SIF. The conclusions that we can draw so far from what we've just looked at are first that Henryk's safety triangle, while it's still very useful and it's still a relevant tool for understanding the relationship among near misses, incidents, and injuries, it's not quite as adept when conceptualizing the relationship between near misses and those serious injuries and fatalities. This is mostly because events with the potential for serious injury or life-threatening consequences are fundamentally different. Also, humans will commit errors. However, organizations should repair gaps in their safety management systems rather than trying to repair or fix the worker. So to really address how to prevent serious injuries and fatalities, we should begin with, well, first of all, begin with this new thinking that we just laid out here, and also begin with some definitions of the concepts related to SIF and to SIF prevention. So let's get into those. So first of all, kind of laying out a definition of what a serious injury is. We don't need to define a fatality. Fatalities, that's pretty well defined. However, there's not yet an official definition of a serious injury in the literature right now. There's still room to arrive at consensus. However, a broad definition that is in use across many of our Campbell Institute organizations and also by several consulting firms is that a serious injury is a life-threatening or life-altering work-related injury or illness. So we'll get into this in a little more when we look at specific organization examples. But this is, like I said, a broad definition that is being used by many who have already started in this field. What does it mean to have SIF potential? A lot of how to prevent SIF hinges upon the ability to identify those situations or work activities that have a high potential for SIF. So while there is not an official definition of SIF potential in safety research, commonly used criteria by Institute members is that an event has a SIF potential if the situation could have been worse if not for one factor. And this is a pretty common definition that's used among our Institute members. So this one factor, it could be a control that was in place. It could be the location of a person or a piece of equipment. It could be the time of day or maybe even weather conditions. An event can also be considered high potential for SIF if it ranks high in a risk matrix that's scored on severity and probability. A SIF precursor. This is another thing we have to define here. So once again, in safety research, none of these definitions are official. However, from what we've been able to research so far, we've come to this conclusion, and a lot of other researchers have come to a general consensus on what a SIF precursor is. So a SIF precursor generally has three key aspects. It's a high-risk situation, first of all, where management controls are absent, ineffective, or maybe not complied with, and it will result in a SIF if allowed to continue. So for a situational example, of precursors with the potential for SIF. I can take as an example the utility industry and perhaps working around power lines. So this work is inherently high risk because it takes place at height around high voltage lines, but it may involve SIF precursors if a worker is not wearing or is not provided appropriate PPE, or if the training on how to properly operate a lift has lapsed. And those breakdowns in management controls, if allowed to continue, could result in a serious injury or fatality for this particular work. Okay. So 3 indicators of serious injuries and fatalities. In addition to the characteristics for SIF precursors that we just looked at, Don Martin of DACRA identifies 3 indicators of SIF. The first is the normalization of deviation. Second is an uncalibrated risk perception or risk tolerance. And the third is decisions with safety consequences that are not grounded in empirical data. So you can probably imagine an example of a situation that involves all 3 of these things. You can have, for example, a workplace where things have, quote, always been done this way. That's a normalization of deviation. You can imagine maybe a team supervisor who is raised in the system and therefore doesn't have a calibrated risk perception. Or maybe it's a work team that ignores occurrences of incidents at other sites just because it's never happened at their site or this site. So those are all kind of examples of these indicators of SIF. However, we can look at each of these in a little bit more depth if we turn to the next slides. So here are some examples of deviation being normalized beyond the, just this is the way we've always done it approach. So for instance, there may be an excess of workers that are improvising in the field because they don't have adequate knowledge of an official procedure. It could also be that workers have developed workarounds for the sake of efficiency, but these workarounds are compromising safety. The application of work procedure or the interpretation of a work procedure may be inconsistent. And variances may be granted too easily, and you might have ineffective management of those exceptions or variances. Another indicator of SIF was that uncalibrated perception of risk among a work team. So not everyone will have the same axes, as we call them, of probability or severity. But everyone on the team should have a good idea. They should have a sample risk matrix in mind when thinking about how to evaluate risk. So this is an example here of a 3x3 risk matrix that could be used by a work team to calibrate those perceptions of risk along probability and also severity. So of course it's important for members of a work team when evaluating a task or evaluating an event to probably land on the same square here in the risk matrix. However, probably even more important than that is that the work team has the same risk matrix in mind and agrees on the calibration of these scales. These are the things that are going to aid safety and mitigate SIF. Another indicator of SIF was that a point about data collection and also decisions not being made with empirical data in mind. So this is talking about data collection, analytics, and when it's not done in a mindful and targeted way, this can actually be an indicator of SIF. So much like when we talk about leading indicators for safety and health, in order to be truly effective, data collection has to be much more than just gathering numbers for the sake of gathering numbers. The information about potential, near misses, and precursors should provide useful and actionable information. Cognitive biases must be controlled. Just because an event has not occurred before shouldn't affect how one ranks it in terms of probability or severity. Analysis of work tasks should be able to answer, what exactly are workers being exposed to? Analysis of corrective actions should be able to answer if workers are effectively being protected. So all of this is to say that safety decisions should not be made in the absence of data and information, but rather based on data and analytics. So as Todd Conklin mentioned, organizations cannot focus all attention on simply fixing the worker to prevent serious injuries and fatalities. Instead, attention should be paid to changes that can be made at an organizational level to the safety management system. So for instance, corrective actions should be designed to be more mature along the hierarchy of controls. Less mature controls are those that depend most on employee behavior. So things that are down here, for instance, relying on employees to put on PPE. This is a last resort. The most mature controls depend the least on employee behavior. So things that you would see at the top of the chart, designing out the risk to the worker or eliminating it altogether. Okay, so now we can get into a little bit of the Campbell Institute member and partner approaches to SIF prevention. You can see the logos of the 6 organizations that participated in this study. So what we did to collect this information from our Campbell Institute members and partners, we conducted interviews with these organizations, asking them about their SIF prevention journey, how they started, the reasons why they began to focus on eliminating serious injuries and fatalities, some of the tactics and practices that they currently engage in, some of the lessons learned. So organizations with superior records in EHS, like our Institute members, they're constantly seeking ways to improve upon EHS. So it's not surprising that many of them have already embarked on designing programs, training, and messaging that focus on preventing the most serious life-altering and life-threatening injuries. So like other organizations across the country, they have noticed a drop in their non-fatal recordable injury rate, but their fatality rates may not be at 0, and even 1 fatality is too many. So for this research, we interviewed 6 of our members and partners, their reasons for initiating the programs, also some definitions. We asked them how serious injury and other terms are defined, their processes for determining SIF potential, and also the training, communication, and leadership around SIF prevention. So even if some Institute members have only just recently started implementing some of these SIF prevention strategies, their processes and approaches, based on the background that we saw in the previous slides, they can be enlightening for other organizations looking to begin their own programs. Okay, so let us get into some of the high-level findings that we took away from the paper. There appears to be a mix of both external and internal forces that drive Institute organizations to develop and also implement their SIF prevention programs. There may be existing guidelines, as in the airline industry, for instance, that dictate the establishment of a safety management system, of which SIF prevention is an integral part. For others, particularly service providers or government organizations, the impetus for SIF prevention may come from clients or maybe from the public at large. So companies like AECOM, for instance, which is a global engineering firm, or ERM, which is a provider of EHS and consulting services, they're helping their clients reduce serious injuries and fatalities. They're already doing that for their clients. So it follows for them, logically, that they should also have SIF prevention programs in place. So that is that's an example of kind of this external drive for developing SIF prevention programs. As for the internal forces, all the organizations that we talk to for this study are driven by their own cultures of safety and the desire to be proactive about preventing incidents and injuries. So even though they all rank at the top of their respective industries in terms of low recordable metrics, they know that safety is a journey of continuous improvement. And so a lot of the reasoning for implementing and developing a SIF prevention program, a lot of that is internally driven. A definition of a serious injury. So not all of our organizations that we interviewed, they have an official definition of a serious injury because their SIF prevention programs are still in development. Most organizations, however, define a serious injury as a permanent impairment or a life-altering state, or it's an injury that if not immediately addressed will lead to death or permanent or long-term impairment. So it does track very closely to what was presented in the first part of the presentation, that it's a life-threatening or life-altering work-related injury or illness. Both ERM and AECOM have a definition of a serious injury or incident that corresponds with an incident's ranking on a severity matrix. Exelon Utilities and SDG&E use a definition from the Edison Electric Institute that lists 14 categories of serious injuries. SDG&E also relies on the Cal OSHA definition of a serious injury, which is usually based on outcome. So if, say, there is disfigurement or amputation, and also based on the level of medical treatment that's required. A serious injury at NASA has the functional definition of a high visibility mishap, which involves a high degree of safety risk, not just as related to personal injury, but also towards the completion of any critical mission milestones. So for several of our organizations, an incident is considered serious not only because of the risk to personal safety and health, but also in terms of property damage, security, environmental impact, and public image or reputation. These are all areas where, should a serious incident occur, the organization's ability to continue doing business or performing work would be curtailed. So it's not just about individual worker safety and health, it's also about those things that impact a business's ability to keep performing their work. Determining SIF potential events. I'm going to take you through a few examples here for how our Campbell Institute members determine SIF potential. At AECOM, all incidents are entered into a system database, and anyone who enters an incident is required to enter potential severity and also potential probability on a scale from 1 to 5. That total risk assessment is the multiplication of those two numbers, and anything with a total score over 10 is labeled as high potential risk. At ERM, all incident and near-miss reports are reviewed by a safety team. And those incidents or near misses that have a rating of 7 to 10 on their 10-point scale will be reviewed again at the global level. At Exelon Utilities, a person from safety and another person from human performance will screen the condition reports that are submitted by workers in the field on a weekly basis. And then the company compiles a monthly conditions report, which is reviewed by senior leadership and stakeholders. And then that information from other peer utility companies is compared to calibrate and also find common trends. Finally, at United Airlines, they have a senior manager of data analytics. And he and his team are in the process of mining incident and near-miss data for SIF potential. And they're looking back at 2 years of data at this point. So this is to go back to that point earlier about, what do you do? How do we derive more from less? In this case, United Airlines is going back into their archives of data to look for those incidents with potential for SIF, or to look for those near misses with a potential for SIF, and see what they can't take away from that data to predict what would happen in the future. Coaching and training for serious injury and fatality prevention. So some of the examples that we'll go through, you'll see some of our organizations have different safety training modules. A lot of times they'll incorporate SIF prevention into global safety topics. So this is something that one organization, ERM, has done. They have a safety training package that covers SIF prevention. And also SIF prevention is one of the topics that's commonly covered by their Global Safety Day events or quarterly or monthly regional training events. Exelon has, they train employees in the 12 criteria of SIF potential, and they focus heavily on the tools to mitigate SIF. They've created teams to conduct trainings in specific areas such as job briefings and also hazard recognition. AECOM has committed to SIF prevention as one of their 3 corporate strategies in order to bring awareness and also resources to the topic of SIF prevention. All employees at AECOM are trained in the SIF prevention approach during their annual global safety training. And at SDG&E, incident investigation teams perform root cause analyses after events and then share that information with other work teams when there are lessons to be learned. And to kind of continue with that, to talk about communication around SIF and SIF prevention. So at Exelon Utilities, for the SIF actuals, team members are required to perform a formal apparent cause evaluation, or an ACE as they call it, which is a 5-page investigation report. And even for those with SIF potential, not just the SIF actuals, but those with SIF potential, team members are encouraged to perform that same ACE, that same apparent cause evaluation. And the output of an ACE is to develop corrective actions, which may be communication changes and maybe process changes. And then the ACE document is shared with teams during meetings so that they can discuss what happened, they can discuss the lessons learned, and any corrective actions. At AECOM, monthly business reviews include a robust safety component where operational leadership reviews safety core value metrics performance and any recordable or high potential incidents. Prevention efforts and near-miss reporting are praised for workers, and they're reinforced formally and informally through recognition programs. An example from NASA is that their serious hazards that can lead to SIF are communicated to employees along with the type of hazard and also who may be exposed. When a SIF record is created in their mishap information system, email notifications are automatically sent out to all those who have been pre-identified with a need to know. So for metrics and targets for SIF and SIF prevention, this is actually, I found this very interesting. So NASA tracks SIF close calls or near misses in the same category as SIF mishaps or actuals. The NASA Safety Center gives their safety directors discretion in setting their own targets for those numbers. In general, however, having 0 SIF incidents is the goal. In a similar manner, Exelon tracks the number of SIF actuals and also SIF potentials. They have deliberately not set a target for these metrics in order to reduce any type of hesitancy or reluctance on the part of workers to report SIF actuals or near misses. So like near miss reporting programs in general, organizations can expect to see a spike in the number of near misses when they roll out a new program like this, just because people are becoming more aware of hazards in their environment, or they feel more comfortable reporting on these things that they've been seeing. And so in not setting a target, Exelon doesn't want to place undue pressure on workers by setting goals or targets for these metrics. AECOM is approaching metrics for SIF prevention in a gradual, progressive manner, which means that the first metrics that they're looking at for SIF prevention are related to awareness, to culture, and also tactics to address SIF, rather than requiring a reduction in the number or the rate of SIF or potential SIF. And their fear is that if they start to focus on reduction metrics too soon, that this actually may lead to underreporting and maybe the downgrading of high potential incidents. So the goal is to eliminate the number of actual serious incidents and also uncover the potential risks that have been hidden in the data. So none of these programs that we've gone through so far hasn't always been easy, that is to say, to implement these programs for SIF prevention. To go from the concept of serious injury and fatality prevention, just from a program standpoint, to the actual implementation of that. All our organizations said that it's very important that there should be careful planning around the process and the roles and responsibilities for the SIF prevention program. Who submits the data and how? Who reviews the data? What are the criteria for determining SIF potential, etc.? These are all questions that should be answered before rolling out the program. The concept of SIF prevention needs to be thoroughly discussed and also owned by the entire organization, especially those who are most exposed to the risks. And those individuals should be closely tied to people who can make resource decisions about the types of defenses and controls that can be put in place. So it can be very difficult at the outset of a SIF prevention program to get everybody in the organization calibrated in terms of the relevant precursors to report. Not everyone has the same preconceptions of risk, which may result in underreporting or maybe some irrelevant reports. You can probably tell by now that SIF prevention, it's not a topic around which there is much standardization or best practices at this point. And that can make it difficult to take a SIF prevention program from concept to actual implementation. Also, there can be different perceptions and priorities on the part of leadership, seeing as they may weigh aspects of risk differently based on roles and responsibilities. So our Institute organizations that participate in this study, they caution also that communication about SIF prevention can't remain solely at the top of the organization. That information must be driven to employees as well. Not extending this information to frontline employees can actually result in more of a divide between leadership and employees in terms of their perceptions and also prioritization of SIF prevention. So I don't want to focus only on the negative, on the barriers to implementing a SIF prevention program, but we also have successes that our Campbell Institute organizations have realized with their SIF prevention programs. So for instance, at Exelon, this has meant the streamlining of the SIF precursor and potential reporting process. So they found that if the reporting process, if it was too onerous, if it was too tedious, this could actually discourage employees from submitting reports and lead to underreporting. So an easier, more streamlined process coupled with that culture that doesn't assign blame for reporting has resulted in more trust of the system and the organization. A success for NASA has been that they've been better able to measure the effectiveness of the defenses or the controls that they've implemented to protect people and systems from serious incidents. So these are some very positive things that have come about from the SIF prevention program, in addition to mitigating any serious injuries or fatalities that could have taken place. All right, so future directions for the serious injury and fatality research. Like I mentioned at the beginning of the presentation, this was just kind of the first paper that we've done on the subject of SIF prevention. We expect that there will be more, just kind of like what we've done previously with the Institute in previous years regarding leading indicators. We see this first paper that we put out as providing a lot of important background information, kind of table setting, if you will. And that's going to give us a strong foundation from which to set forth with some deeper research, with some other follow-up questions that we would have for Campbell Institute organizations. And because so many of them are still just embarking upon this SIF prevention program that they've implemented, there's still a lot more that can be researched and recorded as best practices and interventions for serious injury and fatalities. There's also a strong connection. I mentioned Todd Conklin and Rob Fisher before. There's that strong connection between this study and also that of human performance with the prevention of SIF. Because humans are prone to make errors, an organizational focus on improving human performance is really key to eliminating the distraction that can be at the root cause of so many serious injuries and fatalities. There's also an intersection here as well with the research in workplace fatigue and the fatigue initiative that's within the National Safety Council. So many of the worst workplace incidents in history have resulted in serious injuries and multiple fatalities, and they have at their root cause worker or operator fatigue, which led to distraction and error. So helping organizations understand the level of fatigue risk that's present on their work sites, and also providing tips on how to implement fatigue risk management systems can be instrumental in reducing workplace SIF incidents. And the final connection that we have here is with other Campbell Institute research that we are doing, and that is how SIF can be prevented through better visual literacy for hazard recognition. So the other research project that's currently in progress is training to see if teaching workers the skills for observation and also hazard recognition leads to more proactive hazard reports, among other metrics. So the idea here is that when workers are better able to observe and to take in the details of their work environments, they have this heightened ability to pinpoint hazards that may pose a threat to their health and safety. So here we can see that teaching workers to be more visually literate can be one of those key elements in preventing SIF from occurring. So all this is to say that our research when it comes to serious injury and fatality prevention is not done yet. We're still going forward with it. And what we hope to do in the next papers, I will say plural, going forward, is to not only incorporate these bullet points that you see here, all these different connections with other parts of the safety world, but also to follow up with the Campbell Institute members that participated in this study and to see how their journey is going and what other successes or lessons learned that they can provide to us for next papers when we look at SIF prevention. So my information is here on this slide. So like I said, I am the research associate. And this means that I am not a safety professional, but I do talk to a lot of them in my line of work. So I will answer your questions as best as I can while you're getting your questions in and typing them into the box. I will say that if you are interested further in this study and also others that we've done, that's the website where you can find our research papers. So it's thecampbellinstitute.org/research. And so what I presented here on this webinar is kind of like those high-level results, high-level findings. There's still more that can be taken away from the paper itself. So you can go to the website. You can download the report for free. All of our reports are free. We don't think that safety is a secret. We think that if you have best practices, you should share them. So that's one of our goals and for the Campbell Institute is to share these great safety practices with you all. We also have some other research when it comes to, like I said, leading indicators. We have others on the visual literacy element. So let me take a look at the questions you have here. One of the, let me see. So the question, we have a question here, probably going back to the first slide when we looked at the death rates. That the question was, are these occupational deaths only? Yes, those are from the Bureau of Labor Statistics. Those were occupational deaths only. So another question here. Can you define a SIF precursor? In other words, a high-risk situation where the safety management system is lacking, missing, or not followed, and if allowed to continue will lead to a SIF. Therefore, can a near miss be considered a precursor? That's an interesting question. I'm not sure if a near miss could be considered a precursor, but this goes back to the data mining exercise that a lot of the organizations in the research mentioned. So I had mentioned United Airlines specifically, but this is something that the other orgs in the study are doing as well. They're taking a look at the near-miss reports and the near-miss data that they have from previous years and to see, okay, so basically they're taking near misses as a free lesson. Something almost happened, but nothing actually did happen. Take advantage of that situation of something almost happening, but not quite, and seeing, okay, what were the factors surrounding that event? What was the thing that, the one factor or maybe the couple of factors that prevented this near miss from becoming an actual incident? And so they're using those reports and they're using that data to figure out, okay, maybe there was a control that was in place, and that was the thing that prevented that near miss from becoming an incident. What was the hazard? What was the precursor there? So I'm not sure if the near miss itself could be considered the precursor. However, they are looking at those near misses and those reports to see what those precursors could potentially have been, and also what were the controls or the barriers that prevented it from becoming an actual incident. So I don't think we can say that a near miss is itself the precursor, but we can use near misses to find precursors. Okay. So here's another question. How do you define visual literacy? Well, that's also a great question. So visual literacy meaning that it's the ability to take in information from your environment and also be able to describe it to somebody else in a comprehensible way. And this is why when we were looking at visual literacy for hazard recognition, we're trying to see how people, giving them better tools to observe their environment, and at the same time giving them better vocabulary and ways to describe what they are seeing. So that's how we're describing visual literacy, the ability to see and to take in your environment and also describe it to someone else. And as mentioned from the last slide, we think that this is going to be really instrumental to improving safety overall, but at the same time this could be a key element to prevent SIF from occurring, giving people those better tools to see, to imagine the consequences of a hazard, and then also giving them the agency to fix those things that they see as potential hazards and prevent any SIF from occurring. Okay. Let's see. There's a question here on any thoughts. Have any thoughts been put into developing a Campbell-based portal for members to submit high potential incidents, which are of course sanitized versions? It seems the more data to share, the better. It's a great suggestion. What we're trying to do also at the Institute is to really foster more of that sharing that you mentioned. And it's a lot of times we try to focus on the sharing of both lagging indicators but also leading indicators. In this case, submitting data on high potential incidents, that's definitely a leading indicator if we're talking about SIF potential and not SIF actuals. I think that could be a great idea to not only foster more of the sharing that we want to see among Campbell Institute members, but also get some insight into what other members are doing to prevent incidents, and also, like I mentioned in the beginning, it's the paucity of data when it comes to near misses, and that is kind of holding us back in a lot of ways to predict when the next serious injury or fatality might occur. So you are right. It does seem that the more data to share, the better. And that kind of sharing, even if it's just among the Campbell Institute members, it's something that we could pass on to other organizations outside the Institute as well. So I think that is a great suggestion. Okay, another question here. In regards to SIF potential, why does the Campbell Institute advocate situations that could have been worse if not for one factor? Is this just because it's easier to constrain the problem of defining the word potential? So I wouldn't go so far as to say that the Institute advocates for that definition of SIF potential. However, it is a common definition that is out there in the literature right now. Actually, I've heard from some of our Campbell members that they will define a situation as having SIF potential if not for two factors, so kind of upping the ante a little bit there. And so is this just because it's easier to constrain the problem of defining the word potential? Yeah, once again, there is not a standard definition for potential, but this is something that has been put forth. I think a lot of it does, as you say, have to deal with the fact that it is difficult to define potential in just a few words. So this one is kind of these common definition that's been put out there. I would love to hear if you have any other ideas, perhaps better ideas, for how to define SIF potential. And I think the more dialogue that we have on topics like this, the richer information we're going to have to share with each other, and perhaps advance the science of this even further. Okay, so I'm at the top of the hour. I just want to mention this one last slide. If you're interested in more topics like this, leading edge topics on safety, I really encourage you to join us at the 2019 Campbell Institute Symposium. It's being held on February 19th and 20th in Seattle, Washington. We're very excited for this. The registration link is up on the slide. You can go to thecampbellinstitute.org/symposium. You can go there to find more information and to register. We would really love to have you there and connect with you. And you can hear, once again, more best practices from Campbell members and other leading organizations. So thank you very much for your attendance this morning. I really appreciate it. And once again, if you have any questions, please feel free to send me an email. Be happy to address all that I receive. So everyone, thank you very much and have a safe day.
Thank you, Joy, and thank you to our participants for joining us for this webinar. We appreciate your attention and participation in today's event. You may now disconnect.